Dr. Brody Mack is a servant leader at his core. It's not only the fuel behind many of his accomplishments, but he also shares it so generously with others in contributing to their service endeavors as well. Locally, one of Brody's main areas of impact is at Family Healthcare downtown, where he has an ambulatory care pharmacy practice. He's combined his clinical and scholarship efforts to implement evidence-based, patient-centered care there, oftentimes creating access and providing products and services to patients who otherwise could not afford them. Brody also contributes so much on a broader scale in state and national organizations, serving this year as president of the North Dakota Society of Health System Pharmacists and contributing nationally to advancing ambulatory care services, improving outcomes for patients. Thank you so much for all that you do to serve locally and nationally, and congratulations on the service award, Dr. Brody Mack.
Dr. Mack serves as a leader and a role model because he's always willing to volunteer his time to others and is always trying to progress the field of pharmacy in a positive direction. After seeing Dr. Mack interact with patient and colleagues, I've noticed that he's an incredibly genuine man and that he's able to really care for the patients and try and do what's best for them and what's best for his colleagues and those around him, and is willing to do whatever it takes and go the extra mile to better all of those surrounding him, and I hope I can carry that into my profession.
Dr. Rebecca Brynjolfsson is a valued colleague of mine who continually looks to improve her teaching. And she utilizes technology and comes up with innovative teaching strategies to engage students and to enhance their learning. Her innovative, creative, and excellent teaching methods are an asset to her students and to NDSU.
Dr. Brynjolfsson has served my education in many different capacities. As my advisor, she met with me every semester, talked about my goals, and provided me with advice and encouragement along the way on how to reach those goals. She also coordinated a seamless rotation at a site where I was able to learn about hospital pharmacy and really develop my passion for clinical pharmacy. She shows us how to navigate cases that aren't textbook, how to draw from all of our knowledge and apply to different patient scenarios. I can confidently say that Dr. Brynjolfsson's work in teaching has made a profound impact on my education and future career.
I'd like to congratulate Dr. Pamela Jo Johnson, Chair of the NDSU Department of Public Health, who was selected as the Mary J. Berg Distinguished Professorship of Women's Health at NDSU. Professor Berg was a worldwide leader in the study of women's health. As Distinguished Professor, Dr. Johnson's background in epidemiology and research methods in public health positioned her well to carry on the legacy set by Dr. Berg. Her own research extends her previous work in healthcare disparities by including mental health and women's health across the lifespan, particularly the well-being and health of women as they age. She also studies the role of complementary and alternative medicine in promoting culturally appropriate and holistic healthcare. Again, congratulations, Dr. Johnson, on this wonderful award.
Dr. Mary Larson. brings together multiple organizations, agencies, faith communities, cultures, and generations of people. She is the main organizing force behind the Grateful Garden, located right here on the grounds of Moorhead Presbyterian Church in South Moorhead. It was the first community garden in Moorhead, providing families a share of the season's produce, with all extra produce delivered weekly to Dorothy Day House and Dorothy Day Food Pantry. In addition, Dr. Larson led the way to find a mechanism that allows recipients of Supplemental Nutrition Assistance Program, also known as SNAP, to use their electronic transfer card at the Moorhead Farmers Market, providing access to fresh, healthy food. This unique partnership combines civil, nonprofit, and faith-based organizations, and its success is directly attributable to Dr. Larson. It was so unique and successful that this partnership garnered attention from the Centers for Disease Control and Prevention as a blueprint for other communities to follow. Dr. Larson's role as a visionary volunteer is intertwined with her natural compassion to share her knowledge of public health research. When you add these qualities to her collaborative spirit and her organizational skills, it is readily apparent that Dr. Mary Larson perfectly embodies the role of exemplary public service.
Dr. Larson took the initiative and wrote a grant to establish a community garden addressing food security. She then saw this as a great opportunity for her students to gain experience working in the community. Dr. Larson provides an excellent example of community leadership and encourages us to develop our own voice in leadership and work toward food security.
Dana has always been a rich source of information pertaining to college affairs, and I respect her knowledge on the many facets of the College of Health Professions and of NDSU. During our interactions within the Health Professions organization, I witnessed Dana's key attention to details as well as a positive approach to our queries, ideas, and suggestions. Her confidence in us is the cornerstone and embodies what our organization truly stands for. She deftly advises a group of varied individuals coming from different backgrounds and cultures under a common umbrella, and she does this thoughtfully, with kindness and collaborative leadership.
It is an honor to recognize Dana Davis for this award. Dana's ability to inspire students to get involved both on campus and in the community is unmatched. Each year, she works alongside 25 to 30 College of Health Professions ambassadors to come up with new, fun ways to get prospective students excited about healthcare. She is a unique type of advisor in that she is very knowledgeable about all the health professions offered at NDSU. The most inspiring thing about Dana is how she brings students of different backgrounds and majors together to work as a team toward common goals, much like healthcare professionals must do on a day-to-day basis. Dana prepares students for the real world of healthcare in this way, by encouraging students to take an interest in each other's disciplines. She plays an active role in our academic and career success. If a unique opportunity for professional growth arises, Dana can be counted on to present it to us. Although the advising Dana does is non-traditional, she goes above and beyond for the students she works with every day. Congratulations, Dana.